Have you ever felt a cramp seize your leg so suddenly that it made you wonder if something deeper might be going on? A patient of mine once shared that she used to brush off her nighttime cramps as just getting older, until one evening the pain was sharp enough to make her sit straight up in bed. I want you to imagine this for a moment. You're resting quietly, expecting a peaceful night, when your leg tightens in a way that doesn't feel like the usual muscle spasm. It feels different, stronger, almost like your body is trying to send you a message. Many people assume leg cramps are harmless or simply part of aging, but that isn't always the case. Most cramps are not dangerous, but some carry hidden warning signs that deserve real attention. As a doctor, I've seen countless situations where what seemed like a simple cramp was actually the first clue that circulation was struggling, nerves were under pressure, or a mineral imbalance had been building silently for weeks. Sometimes the body whispers long before it ever screams. What makes this tricky is that these deeper causes often hide behind familiar symptoms. A cramp that feels a little too intense, pain that lingers longer than usual, a leg that feels cold or numb afterward, a foot that changes color in the light. When these patterns show up repeatedly, doctors never ignore them because they can point to issues like poor circulation, nerve problems, early diabetes signs, or even more serious conditions like peripheral artery disease. But understanding these signs is not about fear, it's about safety. Knowledge gives you confidence. Awareness gives you control. And the more you understand your body's early signals, the better you can protect your long-term health. Stay with me, because in the next part, I'll walk you through the hidden causes, simple science, and empowering steps that can help you stay ahead of serious complications. And before we continue, please take a moment to subscribe, like, and share the Senior Health Daily channel so you never miss the guidance your body deserves. Why some leg cramps become warning signs. When we talk about leg cramps, most people picture that familiar, sharp tightening that strikes at night and fades after a few minutes. But what many don't realize is that some leg cramps behave differently. They don't feel like simple muscle spasms. They feel heavier, deeper, or strangely persistent. These are the moments that doctors pay close attention to because not all cramps are created equal. Understanding the difference begins with recognizing what a normal cramp looks like. A typical leg cramp usually comes from a tired or dehydrated muscle. It strikes suddenly, tightens hard, then eases once you stretch or massage the area. These cramps are painful, yes, but they don't leave lingering symptoms like numbness, burning, or skin changes. Dangerous cramps, however, often come with clues that something deeper is happening beneath the surface. Circulation plays a major role here. Your muscles rely on a steady flow of oxygen-rich blood. When that flow becomes restricted because of narrowed arteries, thickened blood, or vascular disease, a muscle can be starving for oxygen even when you're lying still. The result is a cramp that feels more like a deep ache or a tightening that doesn't want to let go. Nerves also contribute to these more worrisome cramps. When a nerve is damaged, compressed, or irritated, the signals it sends to the muscles become chaotic. Instead of guiding movement, the nerve fires in unpredictable patterns. This is why some people feel burning, tingling, or electric shock sensations along with their cramps. A nerve that behaves this way is not functioning typically and needs attention. Doctors also look closely at symptoms like cold feet, pale or blue toes, skin discoloration, and delayed wound healing. These signals tell us that circulation is struggling. When blood isn't reaching the legs properly, the muscles may cramp not from overuse but from lack of oxygen. This is why understanding the science behind leg cramps matters. Muscles rely on blood for oxygen and on nerves for direction. When either system weakens, a simple cramp can become a sign of something deeper. By recognizing these patterns early, you give yourself the chance to protect your health long before complications arise. Dangerous circulation causes doctors never ignore. One of the most important things I teach my patients is that circulation is like a quiet river flowing through the body. When the river is open and clear, everything thrives. But when it becomes narrow, clogged, or slow, The first signs often appear in the legs. Peripheral artery disease, or PAD, is one of the primary circulation issues doctors never ignore. PAD happens when plaque builds up inside the arteries, narrowing the path blood needs to travel. When this occurs in the legs, oxygen has trouble reaching the muscles. A typical cramp from PAD feels like tightness, heaviness, or squeezing pain in the calf that often appears during walking and improves with rest. Many people mistake this for simple aging or muscle fatigue, but it is one of the clearest early signs of blocked arteries. Blood clots, or deep vein thrombosis, are another serious cause. Unlike PAD, which develops slowly, a clot can form suddenly. If a single leg becomes swollen, warm, tender, or develops a cramp that doesn't disappear with stretching, it can be a sign that a clot is restricting blood flow. This is something doctors take extremely seriously because a clot can travel and become life-threatening if ignored. Varicose veins and chronic venous insufficiency also contribute to cramps. When the valves in the veins weaken, blood pools in the lower legs, creating pressure, swelling, and aching that can evolve into nighttime cramps. Many people see varicose veins as only cosmetic issues, but their impact on muscle function is significant. I remember a patient in her late 60s who had chalked up her cramps to dehydration. But when we tested her circulation, we discovered PAD. She told me she had no idea her leg cramps were warning her of something far more important than a simple muscle spasm. With treatment, her pain improved dramatically, and she avoided a more serious complication. The good news is that circulation tests are quick, painless, and incredibly informative. An ankle brachial index test compares blood pressure in the arm and ankle, helping us see whether arteries are narrowed. Ultrasounds can detect blood clots safely and easily. These tests help us identify problems early, when treatment is most effective. Understanding circulation is one of the best ways to distinguish harmless cramps from dangerous ones. When the body's river slows, the legs speak first. Nerve problems behind serious leg cramps. As we move deeper into the body's warning system, we need to talk about the nerves. Most people think of nerves only when they feel the sharp sting of pain or the numbness after sitting too long. But nerves play a powerful and sensitive role in leg cramps, especially the dangerous ones. Nerves act like the electrical cables of your body. They carry signals from your brain to your muscles, telling them when to tighten, when to release, and how to coordinate movement. When those cables are healthy, the communication is smooth and steady. But when the nerves are damaged, compressed, or irritated, the signals turn chaotic. A healthy nerve is like a clean, steady spark. A damaged nerve behaves like a frayed wire, crackling unpredictably. Neuropathy is one of the most common nerve problems behind serious leg cramps. Many older adults experience neuropathy without realizing it at first. They may feel burning, tingling, buzzing, or aching in the feet and lower legs. They may feel cramps that spread instead of tightening in one spot. These sensations come from nerves struggling to communicate. When nerves misfire, the muscles may contract suddenly, even when they are not overworked. One of the biggest contributors to neuropathy is diabetes. High blood sugar damages nerves over time, especially the ones in the feet and legs. I've seen patients who thought their nighttime cramps were just part of aging, only to discover that the nerves in their legs had become overly sensitive from years of blood sugar fluctuations. With treatment and lifestyle changes, their symptoms improved dramatically, but only because they listened to their body early. Sciatica can also trigger cramping. When the nerve roots in the lower spine are compressed, the signals traveling down the leg become distorted. People often describe this pain as sharp, shooting, or traveling down the leg like a lightning bolt. These cramps are not coming from the muscle itself, but from the nerve that controls it. When nerve-related cramps show up with numbness, weakness, balance issues, or difficulty walking, they require attention. A nerve in distress does not heal on its own unless the cause is addressed. And the sooner someone recognizes these signs, the more effectively we can protect long-term nerve health. I once treated a man in his 70s who believed his cramps were from dehydration. but he also mentioned a constant tingling in his toes. When we checked his blood sugar, he was newly diabetic. His cramps were his body's first warning. Once his blood sugar stabilized, his nighttime symptoms eased, and he told me he felt like he had reclaimed control over his life. Hidden metabolic or mineral imbalances. While circulation and nerves are major players, the chemistry of your body holds an equally important role. Your muscles depend on minerals like magnesium, potassium, and calcium to contract and relax smoothly. When these minerals fall out of balance, even slightly, your muscles lose their normal rhythm. Low magnesium is one of the most common hidden causes of cramping. Magnesium acts like the body's natural muscle relaxant. Without enough of it, nerves fire too easily and muscles tighten faster. Older adults often have lower magnesium levels because of diet changes, reduced absorption, or certain medications. Potassium imbalances can also create trouble. Potassium helps muscles react appropriately to nerve signals. When levels are too low, muscles become unpredictable. When levels are too high, the heart itself can be affected, which is why potassium problems must never be ignored. Calcium plays a crucial role in the contraction and release cycle of every muscle fiber. Poor calcium balance, thyroid issues, and vitamin D deficiency can all disrupt this cycle. I've seen patients whose cramps disappeared once we improved their calcium or vitamin D levels. Their bodies were not weak. They were simply missing the chemical support they needed. Kidney problems can disrupt mineral balance as well. When the kidneys cannot filter effectively, minerals shift unpredictably, leading to cramps, swelling, fatigue, and changes in heartbeat. These symptoms create a pattern that physicians recognize quickly. One of my patients, a woman in her 80s, struggled with painful nighttime cramps for months. She assumed it was age catching up with her. After a simple blood test, we discovered her magnesium levels were low and her vitamin D was almost non-existent. Within weeks of correcting these deficiencies, her cramps eased dramatically. She told me she wished she had known sooner how much minerals mattered. Metabolic imbalances often hide behind ordinary symptoms, but when we look closely, the body reveals exactly what it needs. How doctors distinguish harmless versus dangerous leg cramps. One of the questions I hear most often is, how do I know if my cramp is just a cramp or something more serious? This is where experience, observation, and simple science come together. Doctors look at patterns first. Harmless cramps tend to be occasional, relieved by stretching and linked to dehydration, fatigue, or long periods of inactivity. Dangerous cramps are different. They show up more frequently or only in one leg. They strike with a deeper, heavier pain or refuse to let go even after stretching. They may come with numbness, tingling, swelling, or changes in skin temperature and color. Timing also matters. Cramps that appear during walking and disappear with rest often point to circulation problems like PAD. Cramps that come with swelling, warmth, and tenderness can indicate a blood clot. Cramps associated with burning, buzzing, or tingling sensations suggest nerve involvement. These distinctions guide doctors toward the right diagnosis. Age plays a role too. As we grow older, arteries stiffen, nerves weaken, and muscles lose some of their natural elasticity. This makes older adults more vulnerable to dangerous types of cramps, but it also means early recognition is more important than ever. During evaluations, doctors ask simple questions. Does the cramp always happen in the same spot? Do your feet change color? Do you feel numbness afterward? Does walking bring on pain in the calves? These clues help us separate harmless muscle fatigue from deeper issues. When necessary, tests like ankle brachial index measurements, vascular ultrasounds, or blood sugar checks can reveal circulation and metabolic problems quickly. These are painless tests that give invaluable information. What I always emphasize to my patients is that their body gives them clues long before it ever gives them trouble. The key is learning to read the signs and responding with care. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It truly encourages us to keep creating life-saving content for you. the hidden habit that makes serious cramps worse. There is one habit I see often in older adults that quietly intensifies dangerous leg cramps. It is something so simple and so common that most people never think twice about it. It is the long stretch of time spent sitting still or lying down before bed. Whether it is watching television, reading in a recliner, or resting after dinner, the body enters a state of near immobility long before sleep even begins. When muscles stay still for too long, they cool down and tighten. Circulation slows, especially in the lower legs where gravity works against blood flow. Nerves in the legs become more reactive in the quiet stillness of night, and arteries naturally narrow as the body prepares for rest. This combination turns the nighttime hours into a perfect storm for painful or dangerous cramps. I once had a patient in his early 70s who enjoyed watching movies each night before bed. He would sit in the same recliner for hours, legs bent, barely moving. Over time, his nighttime cramps worsened until they were waking him up several times per week. He assumed it was dehydration or age, but when he started incorporating just a few minutes of gentle movement before bedtime, the difference was remarkable. His muscles warmed, blood flowed more freely, and the cramps that once felt overwhelming began to fade. This subtle habit matters because it amplifies the underlying issues we discussed earlier. If circulation is already struggling, extended sitting makes it worse. If nerves are sensitive, stillness heightens their activity. If minerals are imbalanced, immobility makes muscles more reactive. The body needs movement to prepare for rest, and even small changes can have a powerful effect. Early warning signs. Viewers should never ignore your body is incredibly intelligent. It rarely allows a major problem to appear without offering smaller hints first. These hints are not random. They are early alerts that your legs need attention. Understanding these signals can prevent complications and protect mobility well into later life. One of the earliest signs is persistent cramping in one leg only. A muscle imbalance may cause cramps occasionally, but when they repeatedly affect the same leg, it raises questions about circulation or nerve involvement. Another warning sign is cramping that appears during walking, but improves when you rest. This pattern is one of the classic signals of peripheral artery disease. The muscles struggle for oxygen during activity, but the pain eases when demand drops. Cold feet, pale toes, or changes in skin color point directly to circulation issues. When blood flow is limited, the legs attempt to conserve warmth by reducing surface blood flow, leading to temperature and color differences that should not be ignored. Burning pain, tingling, or numbness often reveal nerve problems, especially in individuals with diabetes or spinal issues. Cramps that come with swelling or redness can indicate inflammation or even a blood clot. Rapid fatigue while walking, difficulty climbing stairs, or a cramp that feels deeper than usual are also important signs. Symptoms that appear suddenly, escalate quickly, or feel different from your usual cramping deserve immediate attention. These are not signs of a weak body. They are signs of a body asking for help. What viewers can do to stay safe. Safety begins with awareness and grows stronger with gentle, consistent action. Protecting your legs and circulation does not require dramatic changes. It requires small, meaningful choices that support your muscles, nerves, and heart. Start with hydration, but do it smartly. Drink water throughout the day rather than loading up late at night. This keeps your muscles balanced without disturbing your sleep. Add gentle, leg-strengthening exercises to your daily routine. Even simple heel raises, short walks, or light resistance help improve blood flow and muscle tone. Stretching your calves each evening can make a significant difference. Hold each stretch long enough for your muscles to relax and soften. When the calves are flexible, they are far less likely to tighten sharply at night. Staying on top of blood sugar is essential, especially if you have a history of diabetes or borderline glucose levels. Balanced blood sugar protects your nerves and helps prevent neuropathy from developing further. Maintain heart-healthy habits like walking, balanced meals, and regular checkups. A strong heart supports strong circulation. If symptoms concern you, do not wait. Speak with your healthcare provider. Ask whether circulation tests or blood work could help identify the cause. Early detection makes treatment more effective and prevents complications that affect mobility and independence. What matters most is listening to your body without fear. A cramp is not your enemy. It is a messenger. When you respond with awareness and care, the path forward becomes clearer, safer, and more empowering. Storytelling woven throughout. Let me share a few brief stories that illustrate how powerful early recognition can be. A woman in her 70s once came to me insisting her cramps were simply from old age. She had been experiencing pain in her calf while walking, but she ignored it for months. After a circulation test, we discovered she had early-stage peripheral artery disease. With gentle walking therapy, medication, and lifestyle changes, her symptoms improved dramatically. She told me later she wished she had listened to her body sooner. Another patient, a man with long-standing diabetes, mentioned burning in his feet and intense nighttime cramping. His nerve tests confirmed diabetic neuropathy. By improving his blood sugar control and adjusting his medications, we reduced the nerve irritation significantly. His cramps softened, his sleep improved, and he regained confidence in his health. One of the most memorable cases was an older adult who dismissed a swollen, painful calf as a muscle pull. When he finally sought help, we discovered a blood clot. Because he caught it in time, he avoided a much more serious event. His story became a reminder to other patients that swelling and redness should never be ignored. These stories are not meant to alarm. They are meant to empower. They show how the body speaks, how it warns, and how it responds beautifully when given the attention it needs. As we come to the end of our time together, I want to leave you with something deeper than facts and symptoms. I want to leave you with reassurance. Yes, some leg cramps can signal serious conditions, but early recognition truly saves lives. The body rarely speaks loudly at first. It whispers, it nudges, it asks for help long before anything becomes dangerous. When we learn to listen, we transform fear into strength. Leg cramps are not punishments. They are messages. They are the body's way of saying, I need attention, I need circulation, I need balance. That message is not a sign of decline. It is a sign of life. It means your body is still trying, still communicating, still working with you. Take a moment to appreciate how much your legs have done for you. They have carried you through decades of work, caregiving, and long days that felt heavier than your muscles could hold. They have walked you through joy and sorrow, through milestones and everyday moments. They have lifted you, supported you, and kept you moving even when the world felt overwhelming. That deserves gratitude, not frustration. And here is the beautiful truth. Even at 60, 70, or 80 and beyond, the body can still heal. Muscles can soften, nerves can calm, circulation can strengthen. Small habits done with consistency have more power than most people realize. A few minutes of movement, a stretch before bed, listening to early signs instead of ignoring them. These simple acts protect your independence, your comfort, and your peace of mind. Please remember that you are not walking this path alone. At Senior Health Daily, I am right here with you, step by step, guiding you and cheering for you. Your body still listens, it still responds, and it still wants to carry you forward. If this message touched you, please subscribe, like, and share Senior Health Daily so we can continue this journey together.